So as you might know, the alloSHRINK study is a study where they use CAR T cell in an allogeneic way. So these are not from the patient themselves, they are harvested from a healthy volunteer, and then they're manipulated to act as a CAR T. They are directed against a specific receptor. It's called NKG2D, and it's actually a receptor that is there on malignant cells, but less on healthy cells. So the idea is that you stimulate the immune system and then kill the cancer cells, as we try with CAR Ts all the time. In hematology, it's working really nice, but in solid tumors until now, there are a lot of issues where it's not that active, it seems. So we're very pleased that we were able to do this trial in colon cancer. Of course, it's a phase 1 trial. We present here only 15 patients, the first result in different dose levels. The highest dose level was around 1 billion cells that we give it 3 times in combination with chemotherapy with FOLFOX, and now the study is also ongoing in combination with FOLFIRI, but the data we present here is with FOLFOX. And actually the main goal of the chemotherapy was more for lymphodepletion rather than chemoactivity, because these were usually chemorefractory patients. And what we saw, unless the fact that they were chemorefractory, we saw some responses in quite a number of patients. And so in 8 patients, we saw activity, and even at the highest dose level, we had a few with very good partial response. We did a lot of biomarker analysis. I will not go into detail, but we looked mainly also at the T-cell receptor repertoire, new clones that appear there. And we see in the patients that respond, you see a lot of new clones and some activity in the immune system. So I think the study is certainly hypothesis generating, shows activity and worthwhile continuing, and hopefully in the future also in combination with classical anti-PD-1s, like for example pembrolizumab. So I think the data is quite promising, but as I said, it's quite early.